Okay, can you see the legend? Nakikita niyo na siya? Yes, alright. I'll start playing. Let me know if okay
Reproductive
audio.
organs,
Audio is
first in the
good?
male, then in the female. In the male, we'll look first at the
Audio good?
testes, where spermatozoa are
Yes
formed,
po.
then at the pathway by which they
Galit
reach
siya.
the
Okay, thank
urethra,
you.
then at the penis. The testes are contained in the scrotum, the pendulous sac that keeps them at the low temperature needed for spermatogenesis. The thin skin of the scrotum is continuous with the skin of the lower abdominal wall, the upper thigh, and the perineum. The scrotal skin, which will divide, is more or less wrinkled, and the whole scrotum is more or less compact, depending on the action of a fine layer of muscle, the dartos muscle, that lies just beneath the skin. To see the contents of the scrotum, we'll further divide the skin and subcutaneous tissue along this line. Here's the testis, protected by a number of covering layers. Here's the spermatic cord. The spermatic cord passes upwards, then laterally to enter the inguinal canal, which is here. To see the testis and its surrounding layers more clearly, we'll take everything else out of the picture. The testis is surrounded by a thick layer of loose connective tissue, the spermatic fascia, that's formed by the fusion of two developmentally distinct layers, the internal and external spermatic fasciae, that are derived from different layers of the abdominal wall. We'll draw the spermatic fascia aside. Inside it is an inner membranous envelope, the tunica vaginalis, which we've already opened. This is the surface of the testis itself. The tunica vaginalis creates a fluid-filled envelope around the testis. It's a remnant of peritoneum. Like peritoneum, it has an outer parietal layer and an inner visceral layer that covers the testis itself. We'll go to another specimen to see more of the testis. This is the testis. Here behind it, partly hidden, is the epididymis, through which spermatozoa pass to reach the ductus deferens. The testis, which we've divided longitudinally here, has a tough fibrous coat, the tunica albuginea. Spermatozoa are formed throughout the testis in the seminiferous tubules, which are just visible here. The seminiferous tubules pass upwards and backwards to converge on this fibrous area, the mediastinum of the testis, where they join to form a network of tubules, the rete testis, that's not visible here. From the rete testis there emerge between 4 and 12 efferent ducts, or vasa efferentia, which leave the testis and pass into the upper part of the epididymis. The epididymis is loosely attached to the posterior aspect of the testis. Here it is, more fully dissected. The epididymis has a head, a body, and a tail. In the head of the epididymis, the efferent ducts unite to form one tube, the duct of the epididymis. The duct, which is extremely convoluted, makes up almost all the bulk of the epididymis. Spermatozoa mature as they pass along it. Here at the tail of the epididymis, the convolutions of the duct are quite visible. The tail of the epididymis curls around and becomes continuous with the ductus deferens, which passes upwards to enter the spermatic cord. Now that we've looked at the testis, we'll move on to see the pathway by which spermatozoa reach the urethra. We'll look at the ductus deferens and spermatic cord, the seminal vesicles, and the ejaculatory duct. The spermatic cord is the lifeline to the testis. It contains the testicular blood vessels and the ductus deferens. To see these structures, we'll divide the coverings of the spermatic cord. Here are the covering layers spread out. Here within the cord are the ductus deferens and the testicular blood vessels. The veins that drain the testis are arranged around the artery in a plexus called the pampiniform plexus. The testicular artery is out of sight here. The ductus deferens is a thick-walled tube Its wall is made of smooth muscle. In this spermatic cord, we've divided the ductus deferens. The lumen is quite small. Passing upwards in the spermatic cord, the ductus deferens reaches the inguinal canal, which is shown in tape 3 of this atlas. Here we're at the external inguinal ring. We'll divide these external oblique fibers to get to the region of the internal inguinal ring, which is here. As it passes through the internal ring, the ductus deferens passes backwards. To follow the ductus deferens, we'll divide the abdominal wall and go round to the inside. The abdominal viscera have been removed. The internal inguinal ring is down here. To see it better, we'll remove the peritoneum, and we'll also remove some of the underlying fat. Here are the testicular vessels passing downwards and forwards towards the internal inguinal ring. Here's the ductus deferens. It runs backwards alongside the dome of the bladder, which is here, then crosses the ureter, which is lateral to it, and passes down behind the base of the bladder. Here we're looking from behind at the base of the bladder and the prostate. Part of the prostate has been removed here. On each side, the ductus deferens widens out to form the ampulla, where spermatozoa are stored. Lateral to the ampulla on each side is the seminal vesicle. The seminal vesicles produce a nutrient liquid that forms much of the total volume of the seminal fluid. The walls of the ampulla and of the seminal vesicle are formed largely of smooth muscle. When this contracts, the contents of both chambers pass together into the ejaculatory duct. To see where the two ejaculatory ducts emerge, we'll look from in front at a specimen that's been opened up. Here's the mucosa of the base of the bladder. Here's the internal urethral meatus. Here's the prostate, which we've divided coronally along with the urethra. The cut edges of the urethra are here. The ejaculatory ducts open into the urethra here, on either side of this midline projection, the colliculus. Now we'll move on to look at the reproductive organs in the female. We'll look at them from several different angles, as we did in the male. We'll look down at them from above, we'll look up at them from below, and we'll look in at them from the side. But we'll start by looking at this isolated dissection that shows the whole of the female reproductive tract. Here, we're seeing it from the left side. Here behind are the ovaries. Here are the uterine tubes and the uterus. Here's the vagina passing down through the pelvic diaphragm. This is the base of the bladder. The bladder was here. To see how these structures relate to their surroundings, we'll go to a more intact dissection. Here we're looking downwards and backwards into the pelvic cavity. Here are the inguinal ligaments in front. Here's the pelvic brim. Here's the sacral promontory. Here are the uterus and the two uterine tubes. Here's the left ovary. Here's the right one. Behind the uterus is the sigmoid colon. In front of it, beneath the peritoneum, is the bladder. These are the pelvic organs of an individual past childbearing age. The uterus and the ovaries are quite small. We're looking down on the highest part of the uterus, the fundus. This is the body of the uterus. The cervix of the uterus is well hidden, down here. The fundus and body of the uterus are covered with peritoneum. On each side, this complex peritoneal fold, the broad ligament, tethers the uterus to the side wall of the pelvis. We'll look at its component parts in a minute. When we lift the uterus up, we can see that between it and the upper part of the rectum, there's a deep recess, the recto-uterine pouch, or pouch of Douglas. It's the lowest point in the peritoneal cavity. Here in front, where the peritoneum sweeps forwards from the uterus to cover the bladder, there's another recess, the vesico-uterine pouch, that's more evident when the bladder is full. The body of the uterus tapers down toward the top of the vagina. Here's the line of peritoneal attachment. Just below it, distinct ligaments are attached to the uterus. Here's one of them. These pass forward, laterally, and backward, tethering the uterus to the walls of the pelvis. The lowest part of the uterus, the cervix, projects down into the vagina. To see it, we'll remove this part of the vaginal wall. Here's the cervix, projecting into the vagina. In this specimen, the cervix is somewhat flattened. Around the cervix, between it and the vaginal wall, there's a recess, the vaginal fornix. Here in the center of the cervix is the ostium, or external os, of the uterus. To see a side view of these structures in their natural location, we'll go to a dissection in which the left half of the pelvis has been removed. Here's the pubic symphysis, here's the coccyx, here's the pelvic diaphragm, held in position by a wire frame. Here's the vagina, here's the uterus. The broad ligament was here. Here's the rectum behind the vagina, and the bladder in front of it. Here's the peritoneum coming down off the rectum, forming the recto-uterine recess behind the uterus, and the vesico-uterine recess in front of it. Down at the bottom, here's the vaginal opening, the anus, and the external anal sphincter muscle. Let's take a closer look at the uterine tubes and the ovaries. Close to them, we're going to meet a number of structures known as ligaments. That's a word that's applied quite loosely in this region to name anything from a distinct tendon-like cord to a delicate peritoneal fold. The two uterine tubes, commonly called the fallopian tubes, arise on each side from the upper part of the uterus. To see the tube more clearly, we'll look at it underwater. The uterine tube widens along its length. It's divided arbitrarily into the isthmus, the ampulla, and the infundibulum. The uterine tube opens into the peritoneal cavity. The opening of the uterine tube is surrounded and concealed by these delicate mucosal fronds, the fimbriae. The opening, the abdominal ostium, is here. Normally, the infundibulum is curled around so that the fimbria touch the ovary. The uterine tube is attached to the broad ligament by this double fold of peritoneum, the mesosalpinx. Next, we'll look at the ovary and at the broad ligament and its associated structures. These are the mesovarium, mesosalpinx, the round ligament, and the suspensory ligament of the ovary. We'll pull the uterus forwards to see the ovary. Here's the ovary. In a young adult, it's much larger, as we'll see. The ovary hangs from the back of the broad ligament on its own peritoneal fold, the mesovarium. The medial pole of the ovary is attached to the uterus by this cord, the ligament of the ovary, also called the proper ligament of the ovary. The ovarian blood vessels cross the pelvic brim here and pass beneath the peritoneum to reach the lateral pole of the ovary. They create this peritoneal fold, the suspensory ligament of the ovary, also called the infundibulopelvic ligament. It forms the highest part of the broad ligament complex. The anterior aspect of the broad ligament is tented forward by the cord-like round ligament, which passes laterally, then forward to pass through the inguinal canal. We've been seeing the reproductive organs of individuals who had lived a long time. In a younger adult, the ovaries and the uterus are much more substantial, as we can see in this view of the female pelvic organs made during a laparoscopic procedure on an individual of childbearing age. Here our view is reversed. This is anterior, this is posterior. Here's the uterus. Here are the uterine tubes hanging backwards. Here are the round ligaments. Here we're looking down into the rectouterine pouch. Here's the right broad ligament with the round ligament running within it. Here's the right ovary hanging on its mesovarium. When we pick up the ampulla of the uterine tube with forceps, we can see the fimbria, the ovary, and the suspensory ligament of the ovary.
Hello everyone and welcome back. In this video we are going to walk you through the anatomy of the female and male pelvic viscera and their blood supply. This is the superior view of the female pelvis. Let's orient ourselves to some of the structures here. From the posterior side, here is the rectum on the floor of the pelvis. Then we have the uterus in the midline and the bladder right here. But all of them are covered by peritoneum, and this is part of the anterior abdominal wall. Okay, thank you. Now, this is actually the cut edge of the peritoneum, just for your orientation. So when the peritoneum comes down in the pelvis, covers the rectum, then it reflects anteriorly to covers the uterus. Then practically my two finger going into a deep pouch known as recto-uterine pouch, right there, recto-uterine pouch. I'm going to pull that you can see the bottom part of the pouch here. Then the peritoneum covers the uterus and reflects anteriorly to cover the bladder. So bladder here is under peritoneum. Then there is another pouch here, right there, which is known as uterovesical pouch. Okay, then two pouches in the midline of the female pelvis. So other structure that we want to look at here is if we want to go with the female pelvis viscera, as I said, in the midline is the uterus, that is the body of uterus, and that is the fundus of uterus. Okay, then on the side we have the uterine tube. So if you can hold it for me please. So that is uterine tube. Okay, so right there, and then from the uterine tube we have different part, that is the isthmus of the tube, then dilated part of the tube, which is ampulla, and then at the tip here we have the infundibulum. We have other specimen which shows better view of the uterine tube. On the posterior side we can see the ovary right here. So if you can hold this for me, thank you. So that is ovary, and that is the ligament of ovary that attaches the ovary to the side of the uterus. In this shot, we want to walk you through the ligaments derived from the peritoneum in the female pelvis. So as you recall, peritoneum in the midline covers the bladder, the uterus body, and rectum. However, on the side where we have the tube, right here is the tube. Okay, So the peritoneum covers the anterior abdominal wall, right? And then reflects over the tube and then goes down on the posterior side. So then what it means is here we have a fold of peritoneum known as broad ligament. And between two layers of broad ligament, we have blood vessels, and also here is the round ligament of uterus between two layers of broad ligament. Now, the broad ligament is divided into three parts based on the location of the ovary and an ovarian ligament. Okay, so in order to appreciate that, we are going to go to the posterior side. Okay, so I'm going to ask you to hold this tube for me, please. Thank you. Okay, and then now here we can see the ovary right there. Okay, and then that is the ovarian ligament, right? Now, this part of the broad ligament between the ovary and ovarian ligament and the tube, you can actually stretch that and you can see better view of that. Thank you. Okay, so this part of the ligament is known as mesosalpinx. The part of the broad ligament, mesosalpinx. This part of the ligament here that attaches the ovary to the rest of broad ligament here is called mesovarium. And the last but not least, this part of the broad ligament, which is below to the ovary on the posterior side, and that is actually the part of broad ligament attaches to the uterus on the side, and that is called mesometrium. Mesometrium. In this cadaver, we want to show you the suspensory ligament of ovary. So let's orient ourselves to the area. Here's the pubic symphysis. These are the small intestinal loops. On the left hand side here we have sigmoid colon going to the pelvis. On the right hand side we have the cecum. Okay, we don't have the appendix in this person anyway. And then here is in the midline is the uterus, covered by peritoneum, by the way, bladder covered by peritoneum. And as I said, the sigmoid colon goes down. Here is the rectum. Now I'm going to put my hand actually down here between the rectum and uterus. Then practically my hand is in rectouterine pouch. So when I take it out, so you see the depth of the rectouterine pouch is really deep pouch here. Now, on the sides of the uterus, here we have the tube right there, the sphymberia, and you can see the ovary. Now, the purpose of this specimen is to show you this ligament, which is suspensory ligament of ovary. So as you can see, the ovarian vessels are under the peritoneum coming from posterior abdominal wall. The peritoneum is being lifted by the vessels and form that suspensory ligament of ovary. In this shot, we want to walk you through the sagittal section of the female pelvis. Let's orient ourselves to the area. Here is the pubic symphysis on the anterior side. Here's the sacrum, and then lumbar spine. Now, from the posterior side, here we have the anal canal and part of the rectum here. And then anterior to that, we have the vagina, which ends up to the uterus. Is not complete sagittal section of the uterus anyway. And one structure here that I really want to emphasize on is a pouch here right there between the vaginal wall and the neck of the uterus. So practically this is the cervix or neck of the uterus. This pouch is referred to as fornix. We have the posterior, anterior and lateral fornices, but the posterior one is the one which is the deepest. Anterior to the vagina, on the bottom part here we have urethra, and urethra ends up into bladder. So that is the bladder cavity. So these are the organs in the female pelvis. And of course, the peritoneum on the posterior side as well as the rectum have been removed from the pelvis. In this shot, we want to walk you through the blood vessels inside the pelvis. As always, let's go with the orientation. So on the anterior side, in this specimen, the bladder has been opened. That is open bladder, by the way. So I'm going to close it and then here is the uterus in the midline, right? And the rectum on the posterior side. Okay, so before I go with the blood vessels, a couple of interesting structures here that I really want you to see. Here is one, is this one, the round ligament of uterus that has been actually removed from the 2 layers of broad ligament and nicely oriented here, round ligament. And also, as you recall, I promised to show you the better view of the fimbria. So here is, if you can hold it for me, please. Thank you. So then that is the tube, and then that is the fimbria of the tube. Okay, and that is infundibulum, and that is the fimbria of the tube. Okay, so thank you. Now we reflect the peritoneum on the left hand side here, and then we go with the blood vessels. By the way, this is ureter coming from the posterior abdominal wall. So when it comes to the blood vessel, we start from the aorta. Here is the aorta, and then left common iliac and right common iliac. Then each common iliac is divided in 2 branches, internal iliac and external iliac. And that is the external iliac, which goes all the way down, and after passing the inguinal ligament, then it is going to be called as the femoral artery in the thigh. So back to the internal iliac. The internal iliac has 2 trunks, the anterior, this one, and the posterior, or sometimes it's called division, anterior division and posterior division. So we are going to focus on the branches of the anterior division here. So I'm going to pull that ureter to the right side, that we can see better view of the arteries here. So this artery here, right there, as you can see, it goes towards the anterior abdominal wall. That artery is referred to as obliterated umbilical artery. So is the proximal end of the artery is open, but the distal part here, right there, is closed. Okay? And then a branch of this artery right there is superior vesical artery, which goes to the bladder. Going back again, now here is another branch which goes towards the lateral pelvic wall, and as you can see, it runs with the nerve. That nerve is obturator nerve. Then you can guess the artery is obturator artery. So then the other branch of the anterior trunk, obturator artery. Now back here from the anterior trunk, we have this thick branch here, which is called uterine artery. And as you can see, the uterine artery passes over the ureter. So then ureter is, this is ureter, and that is uterine artery. So we call that as a bridge over water. So the water is ureter and bridge is uterine artery. So in this specimen, we're going to look at actually the other branches of the internal iliac artery. So orientation again, here is the uterus and uterovesical pouch, that is anterior side, and peritoneum here. So I'm going to reflect the peritoneum, and that is the ovarian vessels coming from the posterior abdominal wall. I'm going to pull them to the right hand side, and again the internal iliac artery here, right there, anterior division, right there, and in my hand here, right there, is the ureter. So then you can imagine that is the uterine artery, right? So now this is the obliterated umbilical artery, and as you can see, we have a couple of branches actually here. Both of them I want to call them as the superior vesicle, and one branch here down, right there, goes down, that is inferior vesical artery. And also there is really interesting normal variation here. When I pull everything to the right hand side, as you can see, this is obturator nerve, and you don't see the obturator artery here, right? So then in this specimen, the obturator artery is a branch of external iliac. So that is normal variation, and really common normal variation, that obturator artery coming off the external iliac, not the internal iliac. And also good to know, when it comes to the vein, the tributaries of the the veins are the same as, or the name, or the same name as the arteries, but when it comes to the big trunk, here is the external iliac vein, and then here we have the internal iliac vein, and they join together, they form the common iliac vein, and the right and left common iliac vein join together to form the IVC, or inferior vena cava. In this shot, we are going to show you the sagittal section of the male pelvis. Let's orient ourselves to the area. Here is the pubic symphysis, and that is the sacrum. Okay? Right behind the pubic symphysis, we have the bladder right here. And then under the bladder, we have the prostate. Okay? Then, behind the bladder and prostate, here we have the rectum and anal canal. Now, between the rectum and the bladder, we have two parts, or two of the male organs, male pelvis organs. This is vas deferens, or ductus deferens, and that is the dilated part of the vas deferens, which is known as ampulla of the vas deferens. And then lateral to the ampulla, we have the seminal vesicle. Okay, that is seminal vesicle. We can also see here the urethra passes through the prostate. That is the prostatic part of the urethra. And then the rest of the urethra here, that little part here right there, is known as membranous part of the urethra, which is surrounded by the external urethral sphincter. Then that is practically this brown area represents the external urethral sphincter. The rest of the urethra is called penile urethra, or a spongy urethra that passes through the penis. So we go with other specimen to go through the entire length of this part of the urethra. In this sagittal section of the male pelvis, there is something interesting, medically interesting actually, point that I want to walk you through. Again, orientation is the sagittal section of the penis, pubic symphysis, and bladder right there. Now, under the bladder, you can imagine that we can find the prostate, right? So then you see that this is an enlarged prostate gland, and even that enlarged middle lobe of the prostate gland that makes an elevation in the bladder known as uvula vesica. Uvula vesica. We do have normally really a small uvula vesica, but as you see in this specimen, is really enlarged, and you can imagine how urine actually can stay in this pouch in the bladder, and a lot of like a diverticula inside the mucous membrane of the bladder. In this shot, we want to walk you through the peritoneal reflection in the male pelvis. So here is the abdominal aorta, and that is the peritoneum.
Hi, sorry. I got disconnected. Hold on.
The the pouch between the rectum and bladder, rectovesical pouch in the male pelvis. In this shot, we want to walk you through the blood vessels inside the male pelvis. Let's orient ourselves to the area. Here's a cross-section of the anterior abdominal wall. Here's this is the pubic symphysis, that part right there. We have the bladder and the rectum down there. We can see the ureters coming down from the posterior abdominal wall, and then these two are the gonadal vessels. But of course, this is male pelvis, then we are going to call them testicular artery and testicular vein. So we have the common iliac arteries, which divide into internal iliac artery, this one, and external iliac. Okay, so if you follow the external iliac, goes all the way down, and after passing under the inguinal ligament here, its name is going to change to the femoral artery. Okay. Now, in regards to the other structure that we can see here, that is ductus deferens or vas deferens, as you can see, coming from the deep inguinal ring, or passes through the deep inguinal ring, coming from the inguinal canal, from the deep inguinal ring down into the pelvis. Internal iliac artery is divided in two divisions: the posterior division, which is right here on my forceps, and anterior division right there. So we are going to actually focus mostly on the branches of the anterior division. The first branch of the anterior division here we want to see is the obliterated umbilical artery. See that artery? It goes towards the anterior abdominal wall. The distal part is obliterated, but proximal part is open. And a branch of this artery is this one. And you can imagine it goes to the bladder right there. So then that is superior vesical artery. Okay. The other branch of the internal iliac artery, the anterior division, is this artery right there, which runs on the lateral pelvic wall, and it runs actually with this nerve and this vein all together, obturator vein, artery, and nerve. As you can see, they pass through the obturator canal. My probe actually passes through the obturator canal. Okay. The next branch that we can see here is right here. Okay, and I can see here it goes kind of to the inferior part of the bladder. That is inferior vesical artery. Inferior vesical artery. Okay, now since we are looking actually the pelvis, good to know that the vas deferens here crosses with ureter. See, the ureter passes under the vas deferens, and the expression that we use here, which is bridge over water. So then that is the bridge with vas deferens, and the water is ureter. The other branch of the internal iliac artery that we want to look at is the internal pudendal artery. I'm going to remove the ureter from here. Okay. And right here, that is the internal pudendal artery. Internal pudendal artery passes through the greater sciatic foramen here, and that is the artery, the main artery of the perineum. The veins inside the male pelvis actually are the same name as the arteries. So we are not going to go with the branches one by one. The only thing that we want to see here is that is the trunk of internal iliac vein that joins to the external iliac vein right here, and together they form the common iliac vein. Then left and right common iliac vein, they join together and they form the inferior vena cava. So the inferior vena cava has been cut from here. Okay, so then the veins are the same as arteries.
Okay, so I will give you guys a link to that video because it's really nice. I was supposed to post it as when ako umabot. So I hope you were able to